South African hospitals, by many accounts, is dire. The second wave of COVID-19 in the country is breaking records and is threatening to be significantly worse than the first wave. While hospitalisations and infections are coming down in the Eastern Cape, hospitals are gearing up for a surge in other provinces. Netcare says it's set up a temporary facility because its hospital in Polokwane is more than 100% occupied. In KwaZulu-Natal, it says demand for beds is unprecedented, and in Gauteng, as expected, it's seeing an alarming rise in the admission of COVID-19 patients. Now, in the Western Cape, the Department of Health says models tracking infections show the province has entered the peak of the second wave, but there are still over 40,000 active cases in the province. Let's get a perspective tonight from a healthcare worker. We're joined by Professor Mark Sonderup from the Department of Medicine at Groote Hospital and UCT. Professor, thank you so much for being with us. So if you look around where you are right now, firstly, tell us where you are right now, and just explain what you see, what it's like to be working in a hospital tonight.
Currently, I'm employed and work at Groote Hospital. My team is on intake tonight, and currently in one of the COVID wards. I think if there's any doubt that we are in the midst of a surge, we need to put that issue to rest. And I don't think you should take my word for it, or if you're untrusting of graphs. I think there are a couple of metrics we can look at and kind of tell us really where we are at the moment with respect to this current surge of COVID-19. If you look at a hospital like Groote at the moment, just from an oxygen usage point of view, which I think is a very hard metric as to where you are in a hospital, we're using between 11 and 13 tons of oxygen a day. And in the total Western Cape province, across the public and private sector, there's about 70 to 76 tons of oxygen being delivered and produced a day. So just one hospital, we're burning through about 13 tons of oxygen. In the Department of Medicine, which I work in, if you look at our general intake outside of COVID-19 times, we would admit anywhere between sort of 20 and 30 patients during a 24-hour cycle. That's just general medical patients. I'm not talking about surgery and all the other specialist units. Yesterday's team admitted 70 patients, 70 patients. So I think one starts appreciating the scale of what we're admitting at and where we are at this stage of the actual surge. And I think one needs to look at those hard metrics such as oxygen usage and actual hospital admissions to give you a sense of really where you are at the moment. So we're told we're at the peak. I think, that will be great news, and we just have to see this through. But I think so many predictions have been wrong, so we'll just continue to push on and sort of ride this particular wave and see where we get to.
Professor, does it feel like the hospital is full, sort of bursting at the seams? And what is it like for doctors? Are you still able to do your work, to take care with each patient, or is it about running from patient to patient?
Well, I think it's a situation that, I think at times like these, perspective is really important. I think it would be remiss of me to say that, practicing medicine in South Africa in general is tough. We're a country with a big burden of disease, so even on a non-COVID day, things are challenging. I think what this really is an economy of scale. And there's a markedly increased load of patients, which therefore demands that we've had to open up a multitude of wards. At one stage, we were probably opening up an entire ward for COVID patients every 1.5 days about 2 weeks ago. We seem to have seen a slight slowdown in the last few days, which is perhaps good news. And maybe that corresponds with the peak as to where we're at. But it's been an all-hands-on-deck situation, so everybody has had to get involved, and so we are really busy, and the intakes are busy. These patients are sick; they require a lot of attention. But fortunately, we have the most amazing collaboration and help from other departments, from our colleagues in departments of surgery and pediatrics, etc. We're all lending hands, so it's really an all-hands-on-deck kind of situation. So we're coping, we're getting through it, but make no mistake, it's a tough time, it's a challenging time.
And you spoke about the oxygen. So as I understand it, a lot more patients are being put on oxygen rather than ventilators. Is that working? And is there enough oxygen for the patients at Groote Schuur? Let's just focus on where you are.
Yeah, I mean, I think let's answer the one question first around oxygen. As I've said to you that, you know, this is surgical round number 2 of COVID-19, and it's the same disease, but it is somewhat different this time around. And I think if you look at the range of hospitals being filled up, this time it's both the public and the private sector, whereas last time the private sector really didn't take the brunt as anticipated. This time it is. So it's both sectors utilizing oxygen, and certainly there have been some difficult days. But I must say, to the credit of the province, they've managed that supremely well, and we've never run out, and we continue to push on, and supplies seem to have been stabilized now. There has been a reach out to the suppliers. I think in this instance it was Afrox, and they've done what needed to be done and increased capacity. So we seem to be coping, and I think everybody's done a superb job in that respect. But it's been tight, and the margins are tight.
Yeah. So Professor, you haven't had to watch a patient die because they can't access oxygen. That hasn't been your experience at all.
Well, no. I mean, the reality is that obviously patients are dying from COVID. I think we can't hide that fact. And those are patients who have advanced disease. And that's the nature of this disease in a small percentage of people, unfortunately. But we have a very good triage system in the Western Cape, and I'm sure it's being applied across the country, where patients are triaged accordingly to their oxygen requirement, all the way up to what's called high-flow nasal oxygen. And then maybe just to get back to your ventilator question, those who would be reasonably good assessed candidates to require ventilation are thus then referred on to ICU. And, you know, that resource is always tight. I mean, even in non-COVID-19 times, ICU availability is never something that's easily available. It's no different this time around. But we're basically triaging patients accordingly and giving the people with the best possible chance access to those resources. So, again, as I said, it's an economy of scale. It's what we've always had to do. We're just doing it at a far greater rate, basically.
Yeah. And may I ask what you're seeing on the ground? There's a lot of questions around this new variant. How much more infectious is it? But some doctors have said that they're seeing younger patients really suffering. Maybe this is more deadly. Certainly the second wave looks much worse than the first. Is it surprising to you how this variant is playing out?
Yeah, I mean, I think their colleagues of mine at provincial level, in particular, public health level, are far more competent than I to answer your question, because they're sitting looking at the data. From what we've seen and what I've seen personally as of this morning is that I think there are two things that are apparent and probably are related to the new variant. The one is that the number of patients we're admitting this time around, in fact, again, another metric, is in fact higher than what we did in round 1. So there seems to be a greater disease load of people infected, and that probably relates to infectiousness. But on the other front, the actual mortality rate or the risk of dying from this infection seems to be much the same. But again, it's early days, and I'm not the person to be asking. I think there are people far more competent and qualified to answer that question, because they're looking at that data very closely.
So may I ask you a personal question now? I mean, are you tired? This has been incredible pressure. The lockdown started in March. We were sort of gearing up for July. Then there was a lull, and then it all just got so much worse. Have you even had a break this year?
Yeah, I mean, I think I speak for everyone. I speak for my colleagues. I speak for the nursing staff in particular, who really take an enormous load in this rapid expansion and need for delivery of service. People are tired. I mean, people are. I mean, it's been a challenging 2020, and it feels like we're still in 2020, and you know the calendar tells us all it's 2021. So it's been difficult. It's been difficult, and rightfully people are tired. But again, you know, Francis, I think perspective is really important here. And again, I just want to hammer home the point that practicing medicine in our country has never actually been easy. It's always been challenging, and I think we really should not be fooling ourselves and saying that suddenly things are difficult. Things are always challenging.
Yeah.
This time around, it's just amplified, and therefore that amplification of people's tiredness is just being in fact exaggerated.
Yeah.
So yeah, I mean, we're really hoping this is going to pass soon, and we can sort of get over this hump and get back down to where we were sort of declining on the curve previously, because I think people are getting to the end of the road in terms of their commitment. But I just want to say again, from what I see around me, from my junior staff, from the nursing staff, I mean, it's truly unbelievable. People are just getting on with the job. And that's probably just the true nature of South Africans. We kind of just, at the end of the day, just have to get on with the job and push on, because there's a job to be done. And we need to care for our patients and care for ourselves.
But it must take a huge toll. So how do you cope then mentally and emotionally with this going on around you?
Yeah, I mean, it does take a toll, and I think you have to have some time for reflection and some time out, and it's good for people to have breaks during all of this. And I think there's tremendous background efforts going on to make sure people are supported, and where they need the support, particularly from a mental health perspective, it's available. I think that's a great thing. But, granted, it's not easy. But again, practicing medicine is not easy. And we really are just doing what we all signed up to do and what we agreed to do when we took on these jobs.
Yeah.
It's here for the good times and the bad times, and these are the bad times.
All right, well, thank you for doing what you do, and thank you for talking to us tonight. That was Professor Mark Sonderup from the Department of Medicine at Groote Schuur Hospital and UCT.